Okay, the clavicle is a small, sort of S-shaped little bone. There are two ends to recognize. One is sort of flared and flat. That is the sternal end, which is going to articulate with the manubrium of the sternum. The distal end is flattened. That is going to articulate with the shoulder. So this is the acromial end. So sternal end is very flat and kind of flared out and rounded. The acromial end is very flattened. There is a little bump here, which is the conoid tubercle. So when you orient this bone, when you actually try it on right or left, that flattened, flared end should attach to the sternum, the acromial flat end should go to the shoulder, and that little conoid tubercle, you can feel it, it should be inferior and posterior. So what I do is I just stick my thumb on it from the back, and then I try it on with my thumb posterior and inferior, and I know that it should make a nice collar. Next we have the scapula, which is kind of a cool bone because it floats along the back of the ribs. First structure is the spine of the scapula, this very prominent spine here. At the very end of the spine is the acromion process. So this is where that acromion end of the clavicle is going to articulate. Next we have the shoulder socket, which is the glenoid cavity or fossa, either one. And then jutting off of that process is this fairly bird beak shaped structure known as the coracoid process. Next we have some flat surfaces. Superior to the spine we have the supraspinous fossa. Inferior to the spine we have the infraspinous fossa. And then on the back of the scapula here, that real flat surface, we have the subscapular fossa.